Welcome to the workshop titled Hearing Aids, Over-the-Counter OTC, Direct-to-Consumer DTC, and Connectivity. My name is Kevin Frank, and I am the chair of the HLAA Board of Directors. Next slide, please. Captions are available. Please click on the CC icon and show subtitle. You can change font size and subtitle settings. Chat is available for technical issues and panelists only. Click on Q&A icon to ask questions. We will be using this feature to facilitate questions after the presentation. Dr. Thomas Powers is managing member of Powers Consulting, providing management consulting to the hearing health industry. Dr. Powers received his Bachelor of Science from the State University of New York, Geneseo, and his Master's and PhD in Audiology from Ohio University. He began his career as partner in an audiology private practice and has over 35 years of experience in the hearing healthcare industry. Prior to his current role, he was Vice President, Government Services and Professional Relations for Savantos Incorporated. During his tenure at Siemens and Savantos, he was the compliance officer for 7 years. Dr. Powers currently holds an appointment as assistant professor and graduate faculty in biomedicine at Salus University and as adjunct research professor at Ohio University. He's a member of a number of audiology associations and served as president of the American Auditory Society from 2004 to 2006. Fun fact, in 1988, he had the unique opportunity to fit former President Ronald Reagan with hearing aids, with hearing instruments in the White House. Dr. Powers has lectured extensively at state, national, and international meetings and published over 50 articles. Today, he lectures to you about hearing aids, over-the-counter, direct-to-consumer, and connectivity. I will now turn it over to Dr. Powers.
Thanks, Kevin. I appreciate that. That's really great. Yeah, thank you and welcome to everybody. Thank you for the opportunity to speak to you today on, I think, some very interesting topics. Kevin did give a little overview of, my background in audiology, trying to get my slides to move forward. So, we've already sort of touched on a few of these topics, but, my undergraduate and graduate degrees from Geneseo, and I worked as a speech pathologist in Greene County, New York, which was sort of the turning point for going into audiology and at Ohio University. In my private practice in West Huntington, West Virginia, it was really a great opportunity to really make the turn into hearing aids, so to speak, because most of my graduate and PhD work was in electrophysiology, mostly with chinchillas and later on with infants, but mostly with chinchillas. The great part about that is they don't talk back to you. But in any event, when I finished my work in hearing aids private practice, I had the opportunity to join the industry and move to Siemens Savantos, and then several years ago decided it was about time to ease back a little bit and ease into my retirement. I started my consulting company, Powers Consulting, that you see here. That's sort of my journey and how I got to where I am today. And where I am today is in my New Jersey farmhouse. This house was built in 1843 by Reuben Mitchell. It sits on Mitchell Lane, coincidentally, because it's the first house on this road. It's a really just cool old farmhouse. We have about 10 acres of property here. And one of the unique parts of New Jersey is if you have at least 6 acres of property and do agricultural activities, you can get assessed as a farm. So this is why I refer to this as my farmhouse. The front of the house has been untouched since it was built in 1843. So this was a picture I took the other day when I went out to get the morning newspaper. I thought it was cool because the flowers were blooming. So in any event, hope you enjoy that photo. Today, moving on to what we're going to talk about today. The purpose of my talk today is to talk about two, I think, very important topics. When we were talking with the organizers about a topic for this talk, OTC and DTC are two things that seem to be used almost interchangeably, and while they may have some similarities, some insights into a little bit what's happening in the yet to be determined OTC, and also what's now happening in the now happening DTC, or direct to consumer channels. We'll talk a little bit about some of the federal and legislative regulatory issues around OTC, and as I'm sure many of you know, it's overdue, and so we're still all waiting with bated breath, as the saying goes, to find out what exactly the regulations and specifications are going to be. And also, we'll talk a little bit about connectivity, since that's in the title, how we're connecting to the variety of devices that we all have and use every single day as we move around, talk to our kids, watch TV, go out to concerts, etc. So those are the three main topics we'll be talking about. I've left a couple of points within the presentation. You'll see them come up because there's going to be big question marks on the screen for questions as we move through. So about a third of the way in and another third of the way through the hour talk, we'll have time for questions. So if you do have questions, feel free to put them in the Q&A. We will try to take a few so we don't get too far behind as we move along. And then I've allotted, hopefully, enough time for us to have a fair amount of question and answer period at the end. So if you do have some, feel free to put them in. So why hearing healthcare now? What seems to be the big push, in which the reason we're seeing so much interest? We saw a lot of interest, of course, several years ago in the National Academy of Engineering and Medicine had a number of cast FTC. Seems just about everybody was holding some type of meetings, and they began to raise. It started even earlier with an NIH meeting several years before that in 2009 to really focus on this intersection of hearing loss and aging. Why is this now a public health priority and a societal responsibility? We see articles almost weekly in the newspaper about hearing loss, about its effect, its comorbidities, and its effect on many people, especially our older folks in society. We have some pretty rapidly changing technologies as well, and we'll talk a little bit about some of those a little bit later on. But certainly compatibility with cell phones, a number of these devices and other devices that we're using now to monitor our health, how we sleep at night, what our heart rate is. And I think these types of activities will move into hearing healthcare and as an adjunct to hearing healthcare as we move forward. And of course, changes in some healthcare paradigms. Currently, as we all know, hearing aids are not a covered device under Medicare, which is for the majority of people with hearing loss in the Medicare age range. And that certainly is something that's being proposed, and we'll see how that moves along. So I see we already have some questions here. So let's move on. So I mentioned earlier, just a few seconds ago, that this has become a real issue. A couple of things to point to: hearing loss in the United States, and is twice as prevalent as diabetes or cancer. And we always sort of think about those two disease states as being pretty prevalent. Blood pressure, usually high blood pressure comes in as well. Diabetes and cancer have a huge impact on society, impact on individuals who have either of those conditions. Hearing loss really is right up there between cardiac issues and some others. And of course, you see in the other part of this slide, the economic cost to society of age-related hearing loss is estimated to be almost $300,000 over a lifetime of every impacted person. This comes from an estimate of what it costs in terms of lost wages, physical effect on the individual, healthcare costs in terms of someone who might have increased risk for falls, and other health conditions that are associated with hearing loss, especially untreated hearing loss, such as depression, dementia, etc. So all of these things collectively led us, if you will, to this point, and led us to this point several years ago when the OTC legislation was passed and was mandated for the FDA to give us guidelines for these products. And we'll talk about that as we move along. So why is, again, this such of interest to people outside of the hearing aid market? As many know, there are sort of 5 companies that have the vast majority of the manufacturing capabilities in the world. And we now see a number of people from outside the industry, and we'll mention a few of those, but part of the reason that they're looking at this comes back to this slide. And what you see here is hearing loss level on the left, and on the right, the market potential, or the approximate number of individuals in that group. So about 40% of the people have mild loss, 30% moderate, 15, 10, and 5 as we go up in hearing loss severity. And then you see in the 2 colors, the unaided individuals in orange on my screen, hopefully that's orange on your screen as well, and in blue, the number of individuals who we estimate currently are wearing hearing aids or aided in that group. Doesn't take long to look to see that in the mild to moderate category, that represents approximately 70% of people currently who have some degree of hearing loss. So that's the vast majority of people here in the United States, and we estimate those numbers are fairly similar in other parts of the world. Even though we may not have that data, we would expect to some degree that hearing loss would spread across any population in the same way. Of that group, only 10 and 30% of those individuals currently are wearing hearing aids or some device that are giving them some assistance with their hearing loss. As we move up, the numbers get higher and higher till certainly we reach the severe and profound category where they're aided either with amplification or this could also include cochlear implants as the treatment solution for more profound or severe to profound hearing loss. So we have a huge group of people, as we know, who have hearing loss and are not currently being treated for hearing loss with either hearing aids or implants. One of the ways we try to find out what these groups are, and another way, surveys, and one of them is Market Track, which the hearing industry has done for close to 30 years. And each about 4-year period, we survey a number of individuals in a household, 20, 30,000. This is a fairly large survey to find those individuals who then report there's someone in their household with hearing loss, and then a survey is again sent to them, and we ask them to answer a whole bunch of questions. One of them is, how severe do you think your hearing loss is? And you see that data plotted here for the non-owners on the right side of the screen. The interesting part, I think, is when you compare to the owners, which we certainly know what their hearing loss is, because most of those individuals have gone through the traditional channel. They've gone to an audiologist or a hearing healthcare professional's hearing specialist. They've had an audiogram, so we know the degree of their hearing loss. And if you compare the owners to the non-owners, and we look across hearing loss severity, so mild is indicated by the fairly gray bars on the bottom, moderate, a little lighter gray bars, severe and profound as we go up, you hopefully notice there's a big difference between those people who have had a hearing test and are wearing devices and those that have not had an official hearing test, I'll call it, and are self-reporting their hearing loss. It's almost 3 times the number of individuals from 12 up to 36 to 40% indicate that they have a mild hearing loss when you self-report. Also, if you take a look at the self-report for moderate hearing loss, it's also a fairly large group. It's a fairly large group in the owners, but those are the people with more hearing loss. So when we combine these two, the mild and moderate, you end up with about 70 or 80% of the individuals reporting that they have either a mild or moderate hearing loss. The size of the bars, are different, but it also helps to confirm that this is a large group of people who do not currently wear devices and aren't getting any help. Now, there's a whole lot of reasons for that. We may not go into that today in terms of stigma and some other reasons, but the idea here is that as it relates to OTC, one of the issues is underestimating the degree of hearing loss. And that's what I'm really trying to point out with this slide, is that people tend to underestimate their loss. And that is a concern, that if someone thinks they only have a mild hearing loss and they really do have a more significant loss, they may end up either getting a device, purchasing a device, trying to wear a device that won't give them enough benefit. So getting your hearing tested to know exactly what your hearing loss is certainly always recommended, and seeing a professional, an audiologist, to get that test so we actually can know what your hearing loss is and not just an estimate. As I mentioned, MarketTrack had an entire issue in a journal, Seminars in Hearing. I was fortunate to serve as guest editor for that journal, and we've had a number of great authors. One of them was Brent Edwards, Dr. Brent Edwards, who's worked in the industry and is currently the executive director at the National Acoustics Lab in Australia. One of the premier sites for doing hearing aid research, and also just looking at the market. And in that article, in the Seminars edition, Brent sort of tried to break out how people fall into different categories and what device they might be a candidate for, or what they might choose. And sort of this is what you see in this slide here. And I know there's a couple of boxes I'll try to orient you. The two boxes on the bottom are in red. Those are individuals who have either self-perceived hearing loss, and on the left, less than 25 dB. So those would be individuals that basically have normal hearing. The others have hearing thresholds above 25 dB, HL, which is considered the threshold for normal hearing and above there. So they have self-perceived hearing loss, but they don't report they have really any difficulty anywhere. Meaning if they go to a restaurant, if they go to a meeting, if they go out someplace, they really don't believe they have a great deal of difficulty. These two groups are groups that Dr. Edwards believes will probably be in what he refers to as consumer products. These would be more amplifiers. If they do anything at all, they would try a simple amplifier. But again, you see, they don't report they have any difficulty, so probably they won't be going anywhere. If we look up to the upper right and we see the self-perceived difficulty group with pure tone averages above 25 dBHL, these are folks who perceive they have a difficulty, but reject the idea of going to get hearing aids or seeing an audiologist. They may be people who are part-time or situational wearers, potentially, as I may refer to them, only in those meetings, only when they're out visiting family, difficult situations. The rest of the time they don't want to wear them. And so those would be more candidates, as you see on top, for over-the-counter and or self-fit devices. The next group in green have hearing loss over 25, so they have a hearing loss that's been measured or is above the normal threshold. They have difficulty, and they accept the idea of seeing an audiologist, of seeing a professional, getting hearing aids. And this is the group that's currently wearing devices from hearing care professionals. The last group over in the upper left are those that have hearing thresholds under 25, which might be considered normal hearing, yet they have self-perceived difficulty. This has often been referred to more recently in the audiology community as hidden hearing loss, where they would go and get a hearing test. The hearing test would indicate that they have normal hearing under 25 dB for the entire range of frequencies that are tested, yet they report communication difficulty. They report that when I go to a restaurant, when I'm in a meeting, when the fans and air conditioning are running in some place, I really have a lot of difficulty. And so these are people probably in the past and even today, we might, from an audiology standpoint, say, well, you have normal hearing, you're okay, you can go away and come back when you have some hearing loss. But they're telling us they have communication issues, and we really need to take a closer look at these individuals. And I think this is something we're seeing more and more of in the audiology area to try and identify. How many people are in each of these groups? By estimate from Dr. Edwards, in the hidden hearing loss group, we could see as many 25 million people there. That's a huge group, almost as much or more as the two groups that we see that have hearing loss of 10 or so million in each group. Also, the group on the bottom could be as much as 25 million. So if we think about the numbers that have been floated for the United States of 35 to 40 million people with hearing loss and or communication difficulties, if we take the top line of the 25 people with hidden hearing loss and then the other two groups of 10, we pretty much come close to that number. So they all begin to make sense in terms of the numbers of individuals and where they fall and what type of a device they might be headed to, whether that's an OTC self-fit, seeing an audiologist or a hearing care professional for a hearing aid, or potentially a hearable, this new term that we're seeing for some of the new devices. So OTC has been around, actually, as I mentioned, from 2015 and then further when the other hearings were held in 16 and 17. As we all know, the act was passed in 17. Final rule was passed, and we're supposed to have the rule August of 2020, which clearly is done. These are the issues that should have been out and we should have answers to, but this created a category for people over 18, mild to moderate hearing loss, same technology as hearing aids, user control of those devices, maybe use wireless technology or some type of self-administered assessment of hearing loss, and has to be available without the intervention of a licensed professional and available in person, by mail, or online. So those sort of what the legislation said. Recommendations that came out from the audiology associations in terms of product requirements, outside the box labeling, inside the box risk, and consumer protections. I'm not going to read all of these. We'll make available PDFs afterwards, or if someone is interested. But the headline of this is that in order to fit mild to moderate hearing loss, the recommendation is that the gain of the device should be appropriate for that, given targets such as the National Acoustics Lab targets, primarily 25 to 30 dB of gain and 100 to 115 dB of output. And these labeling requirements should give people enough information so that they make an informed choice about whether these devices are appropriate for them in terms of their either self-reported or tested audiograms, and that they can make a good choice about that it will help them based on the labeling. And then the last one is, of course, that consumer protections are in place. Things like warranty, things like, do I have the ability to return this if it doesn't work for me? And those kinds of things. One of the issues that we think might be involved at the FDA is what's called federal preemption, which is when the federal law preempts or supersedes any of the state law that's out there. In the case of the OTC, it may be inadvertent in that the legislation said that the states won't pass laws that would prohibit somebody from selling or restrict or interfere from selling OTC hearing aids. If hearing aids are defined as hearing aids, and hearing aids are hearing aids, and state law says you need a license, and the federal law says you don't need one, now we have some conflict. And I think it's a very important point to think about, but also I think the FDA has to be very careful how they do this, because the last thing we need is all 50 states trying to now figure out what they need to do and how is this going to work. So we believe that this is an issue that the FDA is probably, I don't want to say struggling with, but trying to figure out how this will work and make sure that the OTCs can be sold as they were intended in the legislation. We have seen some enforcement, and many of you may have seen these if you're out searching or looking on the internet or get emails from places trying to sell you devices, calling their device FDA approved or showing they have a registration certificate. These are being used by, I refer to as bad actors, trying to say they're FDA cleared or FDA registered. this is really not something that the FDA does. They approve a device for market. They approve it to be sold. They don't approve it other than look at it from a safety and effectiveness standpoint. And so one of the things that the FDA has done is to send out some notifications to some folks saying, you really should not be doing this. And they sent a number of companies mailers, letters, I should say, indicating that you also can't be using COVID as a way. We've heard from consumers saying that they've been told that they could use their stimulus money to purchase hearing aids, or that they would get a voucher that looks like $1,000 check, or secure some stimulus money. None of this is true. And I'll repeat that, none of this is true. Warning letters have been sent by the FTC and several attorneys generals from at least 7, or maybe it's up to 10 states out, warning for OTC scams, if you will, that there is no class yet for OTC devices. So you really can't call the devices OTC. That does not mean that we're not having direct to consumer sales, and we'll come back to that. But I think one of the things we should point out is be very careful. And if it seems too good to be true, I don't think Yogi Berra said that, but if it seems too good to be true, it probably is. So at this point, there's one of my question slides. So let's jump. I think I can look in the Q&A, or I think I can do that. I'm just going to read through them. Telecoils are important. I'm going to come to telecoils. How do we expect existing companies to adjust to the FDA guidance? I think once we have the guidance, what we'll see, of course, is that we will have gain and output and labeling and all of the things that are mentioned in that previous slide. And they will have to conform. If they are required to submit a what's called a pre-market approval or a 510K, if that's included in the guidelines, then everybody will have to register as a medical device company and submit data on their devices to the FDA to go through this clearance process. I don't want to call it an approval process, but to be cleared to go to market. Let me see here. Let's see. Yes, the FDA will decide if a 510K is necessary. That will be a part of the rulemaking. We don't know if there will or will not be. It is one of the recommendations from a number of groups. Do we expect companies like Apple, Google, Samsung to play? Yes, Samsung has released a device. It is a hearable, but it does have some functionality for low gain, and it's just referred to as a hearable. Apple has released a number of features that allow their AirPods to do a lot of things that are very hearing aid-like. For example, noise reduction and directional hearing. So I think we've already seen that, and from their patent portfolio, we do expect that these companies certainly will jump in. And when might these come in? That's anybody's guess. It was on the June agenda, so if it is imminent, the timeline is once that's issued, there will be 60 days for comment from the public and all concerned stakeholders, and then the FDA would have up to 180 days to finalize those regulations and guidelines, and then reissue them in the Federal Register. So if we take the maximum and it came out tomorrow, it would be about 8 months from now, or early in 2022. So I think we'll keep moving so we can finish up. We'll go back to any of those questions if they become really important at the end. I want to touch a little bit on delivery models, because I think this is really an important part of the OTC, DTC, OTC discussion. And I have a number of logos up here, and I'm going to come back to them individually. But healthcare is sort of becoming retail, and retail is becoming healthcare. And I say that because if you look at some of the companies sort of at the top of this slide, we think of them more as retail stores. And while CVS is a pharmacy, we could, I guess, call that healthcare. Up until recently, they also sold cigarettes and other, potato chips and milk and things like that. So we're seeing a real change in the delivery model. And so let's look at these here. Costco, and Sam's and BJ's, I'll group those three together. We all know about Costco. They've been very active in the hearing aid business for quite some time. And they have a footprint, if you will, here in the US and worldwide at their locations. I believe there are over 400 here in the United States. Vast majority, I don't have an accurate count, do have hearing aid kiosks, whatever we want to call them, little offices, if you will, within the Costco building. Sam's has come along as well, obviously to compete. They're a competitor to Costco, as is BJ's. CVS was in hearing aids for a while. They're sort of out, but they're back into healthcare, as Walgreens is, certainly within COVID and vaccinations. But CVS, I think, is unique, and they also are bringing in healthcare related activities like Smile Direct Club. So now there are about 50 or 75 CVS pharmacies that have the capability to have a scan of your mouth, to have the brace, invisible braces done. So we see this portal to healthcare opening in local areas. 10,000 CVSs across the United States. Their CEO said that they want to be the front door for healthcare. And I think that it's a very interesting proposition, because there's a lot of those. They're in local communities, and that's a place that people do look to some degree for healthcare. Online delivery is exploding. We could call this online. We could call it DTC, I guess. You may or may not be familiar with all these names, but I'm going to show you some shots of their websites in a second. But Lexi is a company, or hearing aid product, I should say, a name of a product that's being sold, and it was started by HearX, which was a company out of South Africa, primarily involved in some telehealth activities and online hearing testing. But they now have a brand of hearing aids called Lexi. They have a commercial that I've seen running on TV, which is pretty fascinating. It's pretty funny, I think, in some degrees. Lively has a delivery system that involves professionals who are audiologists, and that will actually work with you through the process. Hearing Planet, you see the rest of them here. Hear.com, fairly large online presence, and Zip Hearing, which is a new one, which also is professional involvement. Managed care and employee sponsored care, Medicare Advantage programs. I think the latest estimate I saw was somewhere over 80% offered some combination of vision, dental, and hearing benefits. It certainly is a way for people to encourage member to join their particular plan, because those are the three big items that certainly are not covered under Medicare for people that are over 65. So an expansion in Advantage is really driving a little bit of this expansion, if you will, of hearing related services through Medicare Advantage programs. And then member discount programs, AARP, auto workers, AAA, for either their members, providing a discount if you go to a local professional. So those didn't exist 10, 15 years ago. Certainly not when I was in private practice, as much as it pains me to say, in the late 70s and early 80s of the last century. Another thing that I think has had a real positive impact is this idea of things in our ears. I was going to show a picture of an I think they're called AirPods. I don't have them. I have Dr. Dre Beats on here, but AirPods and all the Bluetooth headsets that started coming several years ago began, I think, a process to sort of move away from the stigma of having something on or in or behind your ear. Even though the early ones had this blue light flashing as you'd walk through the airport, because you had your Bluetooth headset on, people didn't seem to mind the blue light flashing because they didn't have to hold their phone. It was a convenience. We're now seeing some of that evolve into the hearing aid technology in terms of designs of devices being different than what we normally think of. And part of that is being driven by what you see on the bottom, is by battery companies providing batteries that are different shapes than the round cell. If you have a round cell, the hearing aid case has to sort of accommodate the round cell. If you change that shape to this long oblong battery, now all of a sudden you can create new shapes like you see here on the screen. This is one from one of the major manufacturers. And it's very slim, comes in a lot of different kind of two-tone colors, so it's sort of authentic. Used to be only kids would like to have either blue or pink or purple hearing aids. I'm not sure a lot of adults are going to go blue and purple, but certainly white cases that might match hair color, etc. I think are becoming at least more accepted. And I think the stigma, we hope, is moving forward because of a lot of factors. People having stuff in their ears and also some of these new designs. One of the things that I find interesting, I mentioned earlier, is the use of sensors, both in hearing aids and potentially in other parts of the system that we have for amplification. We have one today from Starkey, one of the manufacturers, that has motion sensors that can detect falls and alert you and or somebody who's on your list of people that if you do have a fall, which could be very helpful for anybody who's certainly, we don't want anybody getting hurt and being caught in the middle of their room with no assistance. So these kinds of sensors being built into the chips that are inside hearing aids and or communicate to your phone will I think begin to expand further the role that these devices have in not just hearing care, but in healthcare in general, so that we can detect other kinds of activities. And one of the more interesting ones that was just shown at a recent meeting I was at was, hopefully you can see it, but in the device that looks sort of like a receiver in the canal or a custom hearing aid at the end of that wire, there's some little bumps there. And those little bumps are sensors that can pick up EEG activity from your brain while that hearing aid is behind your ear and that little ear mold is in your ear. And those sensors then can pick up that activity and translate that after, obviously some period of time using current technologies, artificial intelligence, to potentially alert to a variety of different health issues, changes in EE activity for seizures, for someone who has potentially Parkinson's, for a variety of issues that now is built into a device you're already wearing. You don't have to get another gadget to wear. I think the future of this is a ways off, but it's very intriguing, I think, from a scientific standpoint, and I'm certainly interested in how this is going to progress. But it does begin this hearables, hearing aids, broader healthcare monitoring, moving into devices that we're going to be wearing. I say we in the hearing community in the not too distant future. Over the counter is already here in healthcare. I mentioned Invisalign. That you can get those online. CVS, as I mentioned, has a pilot program. Warburg Parker, I should say, Envision, and all kinds of monitors and blood pressure stuff, and you name it that you wear on your wrist there. For those of you that might think mail order or buying things through the mail is a recent phenomenon, I just want to point out to you that some of these really old pamphlets here that I happen to dig up, one of them was from 1910. So I'm sure some of those devices you really don't want to wear anymore. They're a little bulky, but those have been available through the mail for over 100 years. So this isn't a new phenomenon. So some of those names you may not recognize there, the Morley Company and Mega Earphone, but they've been around for quite some time. Just to give you an idea how many companies and brands there are, I know you can't see this, but this is from Hearing Tracker, one of the websites out there that shows all of the brands by all of the companies that at least we know of as of today. It'll probably change by tomorrow. And if that's not confusing enough for you, I'm not sure what might be. It has become if you just look at the top line, there's only about 7 or 8, 9 companies on top, but all the other rest of it is all the companies, both in the equipment business, cochlear implant manufacturers, audiometers, et cetera, et cetera. So a lot of different names out there. Coming back, DTC, direct to consumer, this new channel that evolved when the OTC was delayed. As I mentioned, mail order and hearing aids being sold through the mail has been done for quite some time, sort of on a low-key basis. But as this OTC discussion ramped up, and then even after the legislation, we began to see companies come into the marketplace, and a whole bunch of different delivery systems have evolved. And I sort of put these in 3 buckets, and these aren't all of them. I just try to put some names out here to give us an idea of what they are. The first bucket is no professional involved. You buy the device, it's yours. There may be an app that you can make some adjustments to the overall gain and or the response, sort of like bass and treble, sort of like your stereo. So Zbox and Samsung are 2 brands there. You may have a professional involved via a website. They may be for aftercare, Audicus, MD, Nopal, and you see the names of the companies there. And then the professional being involved, Lively, Eargo, Lexi, Zip Hearing, Hear.com, Hearing Help Express, which is a company owned by Intracon, pretty much have professionals involved from the start of the process. When you begin the process and buy the device, when it gets to your house, they encourage you to call them, and part of their delivery system is that you get on the phone with an audiologist to work through getting it out of the box, putting it together, getting the domes on, get it in your ear, how do you do the fitting process, etc. So 3 different sort of ways, and again, depending on the usage and the sophistication and the type of hearing loss, a lot of different models out there. A lot of different form factors, as I call them, Eargos you see up there with the little gadgets on the end that kind of looks like a fishing lure, but it's actually the earpiece that fits in your ear. Nuheara, iHear, Audicus, MD on the bottom, they look more like traditional hearing aids. Bose, as we know, has just entered also the marketplace. I don't want to say, I say a new entry because they finally now are selling in the market. They had a device that was approved a number of years ago, but now it is out of the market. You see it there. It looks like a traditional hearing aid for mild to moderate, self-tuning, self-fit, has a replaceable battery. It's being sold currently only in the states. You see there, Massachusetts, Montana, North and South Carolina, and Texas. This is a device that did go through the process with the FDA. They are cleared as a wireless device to be sold in the direct-to-consumer market. As I'm sure you've all either seen the emails, these are $849 for the pair. So just to give you an idea on price. Some of the other ones: Audicus, Eargo, Lively, Olive, Whisper, these names. Nuheara is also working with Hewlett-Packard. Very interesting collaboration. So we begin to see these aren't just small companies. Hewlett-Packard is a huge company, and they are working on headsets, earphones with Nuheara technology for HP. So something else to be coming. Audicus, just to give you a very quick overview, is sort of a pay-by-month program. This may be for some people where the upfront cost becomes prohibitive, and so now anywhere between $39 and $98 per month you can be billed for these devices, and then every 18 to 24 months you get a new set of devices, much like a car lease, I guess. Whisper is a little bit different model. You see the Whisper Brain over here. The Whisper Brain is really the brain of the system. It talks to the earpieces in the center, and there also is an app which can be used for software upgrades for the devices, as well as to make some fine tuning. But the Whisper Brain is what sort of monitors the activity that you're in and begins to make changes along the way to your devices. So a very different system. So you now have 2 devices. I should say 4. Two of them go in your ears, your phone, which has the app, and the brain, which you also have to carry along with you. So it becomes a little more complicated. Nopal is a device that attaches to the bottom of your iPhone, and has some directional microphones that provides you some capabilities to give you better quality on people's voices in noisy environments, reduces background noise, it has a directional component, and it works primarily with iPhone and AirPods. Can be used in a variety of situations, but again, and I'm not endorsing any of these, obviously, I try to give you the scope of what's out there. This is a little bit different in that you use your current AirPods together with this device to give you some additional clarity and noise reduction. Olive Pro is a new company. They're out of South Korea. They have gone through the FDA process to register as a medical device. These are a 2-in-1. So in essence, these are an earbud primarily for listening to music and, out when you're jogging or whatever. But they also do have some amplification with them, as well as, some directionality and noise reduction. So I would classify these as somewhat more of a hearable, but they are classified as a hearing aid from the FDA perspective. So those are a few of the devices that are out there. There's more. I'm sure if you've done searches. Another part is with OTC is how comfortable are people going to be with doing the tasks that are necessary to really be successful with OTC. And we asked this question as part of our market track, and Brent talked about it in his article in the seminars and hearing. If you look at the sort of blue to bluish, those are the fairly comfortable to the left, those you're okay doing them. And the orangish sort of colors on the left are sort of not comfortable. Most people were fairly uncomfortable, at least half of them, assessing their own hearing, selecting a device. The one they were most comfortable with was cleaning and maintaining, which seemed to be they had the highest comfortable ratings. Seemed interesting if you don't know what the device is that you're comfortable cleaning it, but I guess you figure it's probably not difficult to clean the device. And then troubleshooting, it jumped up again that was problematic. So I think one of the issues that we're going to face is this whole idea of what is the instructions? How do you take care of that? Do you need videos? Is there going to be a website? Is it going to be an app on your phone that's going to have all these things to tell you how these things work? And I think this clearly tells us that this isn't just simply taken out of the box and stick it in your ear. There is going to be some work attached to getting these devices set up for you to actually give you some benefit. Successful fit and use. Stigma is a little bit less. I think I sort of should put that near the bottom. What's the motivation? If there hasn't been motivation up till now to go get a hearing test, will people do that? Online hearing tests have become available. The calibration of those tests sometimes are called into question because we don't know exactly what headphone or what set of earbuds or whatever you're using. And then what's the support structure out there? If you get one of these, where do you go and what do you do? Is the manufacturer providing that support? Or do you look to your local hearing care professional or audiologist to go in and say, listen, I got this device and can you help me use that? And I think a lot of audiologists are beginning to realize that that's going to be the opportunity for them to help people with these devices because they're going to need some assistance. You may not have bought it from them, but hopefully they're the experts that can help you make sure you get it in and out of your ear and that you use it appropriately. So let's jump into the Q&A box here, and let me see what some of the more recent. I think the more recent ones are at the top here. Yeah, they must be. Oh no, they're at the bottom. No, I went that the wrong way. Okay, let's see what major companies show insurance plans. Do we expect that insurance plans will help self-diagnose and buy OTC? At present, we don't expect that that's going to happen. There's current legislation that's in Congress related to Medicare primarily looks at either severe to profound or moderately severe to profound losses and excludes OTC. I think a lot of the Medicare Advantage, I was blanking on that term, Medicare Advantage programs already are engaged with third-party administrators who are using traditional hearing aids as a part of their program. So at the present time, I wouldn't expect there would be insurance companies coming out and providing coverage for OTC, at least at the beginning. That may happen as we go forward, as more of the companies come in, as the traditional manufacturers also offer OTC options. Once the guidelines are out, we might expect that to happen. Some significant reduction in hearing aid prices. Probably, we already see that with Bose. We're going to talk a little bit about pricing in a second. I think, part of the issue is the delivery model, and that is you have both the product and the cost of the services. They tend to get bundled. We'll talk about unbundling in a little bit. Why do I think Bose is only selling in those 5 states? A lot of speculation. I don't know, because they haven't told us, and I don't have anybody I know on the inside that will tell me. But I think part of it is certainly that there are a couple of states where mail order, and this would be considered mail order, whether you call it DTC, OTC, but mail order is not allowed according to the regulation, state regulations, Florida, Oregon, some others. Now, of course, you have to have some enforcement, and if you send a hearing aid through the mail, my traditional joke is that you've seen the hearing aid sniffing dogs in the airports. The Attorney General probably isn't worried about a hearing aid going through the mail. They're more interested in using those dogs for other contraband like drugs and other things. So enforcement becomes an issue. But I think that's probably not the main reason. We've speculated that there are a variety of different kinds of states. North and South Carolina do have a reasonable older population. Texas is, a big state. Montana is a small state. Texas has a lot of big cities. Montana is pretty rural. Maybe there's test market going on. A lot of speculation as to why. I don't think anybody really knows. Typical hearing aid, 500, but again, apply to OTC. What are the implications for traditional brick and mortar? I think to me that's the biggest question. How do these get integrated into the traditional practices today, whether it's an audiologist or a hearing care specialist? I think my sort of audiology gut tells me that I think a lot of them will handle and will have these in their practices. How they do that is going to be a little more complicated, given the way currently hearing aids are sold as a bundle. However, we are seeing a number of institutions as well as practices move to unbundled models, and I'll talk about that in a second, because I think that's what's going to happen. You need to separate the service component from the product and all the diagnostics from the product. And as this continues to evolve, I think the retail channel, whether that's audiology, et cetera, will have to evolve with it. And there will be some changes to how that's done. And you'll see a little more transparency, which was a big request, if you will, of the FTC, the Federal Trade Commission, in their meetings they had prior to the legislation was, why does everybody have different names for the same feature? Why not just call it a directional microphone? Why is the pricing not quite so transparent, et cetera? So I think the transparency will also come through. Speaking of unbundling, so that was a good segue. FTC could issue a rule, much like it does for eyeglasses and contacts, where you get a test and a prescription, and then you get that and you can go buy them. The OTC pricing may drive that, or consumer demand. We have a single fee model, complete fees, services, long-term care. Maybe you would come in with an OTC device and there would be a specific price for a visit of a half hour, an hour, which would show you how to use that device, where to sit when you go to a restaurant, et cetera, et cetera. And then you leave and you may not be back to that office again. So I think there's a lot that yet has to be determined about how this whole OTC channel is going to evolve into the existing structure. These self-fitting devices, they're going to continue to come. The form factor, the signal processing that they have, what the fitting rationale is, how do you manage the user instructions, what makes them successful, what accounts for the usability. One hint we have of that is there was a study done in Australia, it goes back several years ago, but they took a look at self-fitting hearing aids and just gave people the devices and said, okay, here they are, and here's a basic set of instructions, and go at it. And what you see is that about 25% were successful, putting it together, getting the dome on the end. I think they were RIC-like devices, getting in your ear, taking an app, figuring out how to use it. Another 43% had to get some help, and about a third of them just were unsuccessful. They just couldn't do it. So we know that there's going to be a need for some assistance. I think this is part of what may drive the change to the retail and audiology market. I want to talk a little bit now. We got a couple minutes left here. I may go over. I said I wouldn't, but loop technology, as we can talk about connectivity. Loops are something that almost always gets brought up. I've been going to HLAA for I don't know, 15, 20 years. And they are a very robust technology. Unfortunately, it seems like they've fallen out of favor a little bit because Bluetooth seems to be the new way to connect. But for those of you familiar or not, obviously we have a wire around the room. The person who's speaking has a microphone or a lapel mic, and then that signal is fed to the loop, which then can be picked up by people with their T-coils. A very, very effective system. It's inconspicuous, it's cost effective because it's a relatively inexpensive system. And of course, there you see the icon for that. And I don't know if Dr. Sturkins is on, but she's I've known for more years than either of us want to admit, but she's been a huge proponent of loop technology. And the way to support that from the manufacturers is, Telecoils, even though with Bluetooth can have T-coils, it's not easy because those two antennas like to fight each other. But the way to do that is to separate them. And you see here, one example is that one of the companies has exchanged the battery compartment and has a T-coil integrated in the battery compartment, which then puts it near the bottom of the device so that it doesn't fight with the Bluetooth capability and antenna, which is typically located toward the top of the device you see here. So it is possible to do, and it does exist in some devices, and there still is support for T-coils going forward. We're connecting to all kinds of stuff with Bluetooth, TVs, telephones, mobiles, you name it. Phones being usually one of those things. It's interesting, our thing, we call them our mobile phones, but we use them probably the least for phoning and for everything else more of the time. What features are being used? We've got VCs on hearing aids, we've got apps, we've got connectivities, we've got things that connect to our TVs, we've got intermediate devices that if we don't have an iPhone, we can transmit to that device, which then transmits to our hearing aids. So we have a variety of ways to connect. It becomes complicated, and sometimes to get these things to all talk to each other right now is not the easiest thing to do, but it is possible. Telehealth is coming and is going to be, I think, the way forward. The COVID has taught us that this is the way we're going to move forward. So. The apps, I know there was discussion in the meet and greet about apps and also about turning features on and off. Apps are almost across all manufacturers. So if you're not using it and they haven't told you about it, go back and yell at those people.
Hey, Tom,
here's an example. Yeah.
Just before, well, I'm just going to say the final announcement, and then if people go over, that's great. But okay. I just want to thank you for a great presentation. And after this workshop, the virtual exhibit hall will be open. Go live chat and view demos from one of our exhibitors, and you can access the event hall from the main lobby of the platform. And Tom, back to you, and go as long as the system will let you. Okay, I think I'll have a couple more left here. Here we are, take home messages. So I think, again, we've seen there's some just new definitions of what the healthcare needs are of all of the folks out there, and I include myself with hearing loss. We have a whole bunch of new categories, a whole bunch of new devices, new delivery systems, teleaudiology and self-care are going to help us grow this.
I think, and get more and more people help that they need. I'm sort of encouraged by the way not only the technology, but also the delivery systems are evolving. There's sort of been a joke that we're going to get our hearing aids in aisle 2, and there you see toothpaste, mouthwash, antacid, hearing aids, and there's the little kiosk in the back where you can go pick up your OTC device. Sort of a funny way of saying hearing in aisle 2 as opposed to a spill in aisle 2. So with that, we went a minute over. I will go back into the Q&A for those of you that do want to hang for a minute and see if there's a few other questions. Typical hearing aid, what we might think the typical cost of the new OTC devices. If Bose is an example at $900, so about $450 a device. My personal prediction when this started was somewhere between $300 to $600 per device. So it seems like the Bose device is in that category. Some of the others from Audicus and others seem to be somewhere in that category, some a little bit higher. Eargo and some others tend to be, maybe on the higher side of that. But again, I think you'll see that, at $600 or $700 for some of these devices. We mentioned Costco. I mean, their current Kirkland Signature is about $1,400 for the pair, which includes professional services. So that's $700. So we're beginning to see, that sort of range of devices. Will audiologists embrace OTC? We talked about it. Price range. Any data on OTSNs giving up hearing aids because they couldn't get them? Yeah, there are examples of people giving up on OTC. In the previous market track, we asked people about, well, we called them PSAPs because OTC wasn't around, but people who had personal sound amplification products. And there was a fairly high return rate for those devices. Granted, those were some of the very early devices. A lot of them didn't have apps. You took it out of the box. You could turn it up or down, maybe had some very crude controls. So I think early on there was not, I don't want to say there wasn't a lot of success, but there also was a lot of returns. I think some of the devices you're seeing today, are much, much better, certainly out there. They have adjustability apps. Some of the even very simple devices have a way for you to fine tune them. The Bose device, their clinical data showed that you could fit it fairly closely to the NAL2 targets, which are the targets that most audiologists and manufacturers use to do at least an initial first fit, as it's referred to. And that's usually fairly successful for somewhere around 70% of the people. So I think, it is a way I think that we will see it being successful for a lot of people, with the caveat that I think in order for you to really know that, my suggestion would be to get your hearing tested so you absolutely know what your hearing loss is, that you don't just decide what you think it is by feeling the bumps on your own head or some other way. Know what your hearing loss is, know what kinds of environments you're having difficulty with. Talk to your family, talk to your friends. Am I asking you to repeat all the time? But get a hearing test, because then you're going to know the severity and the shape of your loss, and they can give you an advice on whether maybe an OTC device is appropriate for you or not. And then at least you have informed consent, if you will, for yourself about the kind of device you're going to get. So I think with that, I want to don't take time away from people being to the exhibit hall. We've gone a few minutes over. I don't see too many, too many other questions that are sort of similar. So with that, if there's any closing comments, I will thank you all for attending. I appreciate you being here, and hope you learned a little bit about OTC and connectivity. Thank you again.
Thanks again. That was a great talk.
Thanks, Kevin. Take care, everybody. Have a great day.